and start the recording. And we will get started. So thanks for joining us today for Trust for America's Health, our series of training sessions in our AIDS-friendly public health system initiative. This is session 5, focused on the Healthy Brain Initiative Roadmap. And I'm very pleased to be joined by some excellent speakers today. But first, just a couple of housekeeping notes. Karan, is there a slide for housekeeping? If you could advance that, please. If everyone could just please keep your, make sure your computer or your phone are muted during the presentations, and we're happy for you to unmute to ask questions at the end. But also please use the chat function to offer comments, links, resources, and any additional questions that you may have. That would be great. So go to the first slide for us, please, for Dr. McGuire. So today's presenters today, oh, actually you can go back, sorry. I didn't realize you had their names, they're awesome. So we're joined today by Dr. Lisa McGuire, who is the lead for the Epidemiology and Applied Research team in the Healthy Aging branch at the Division of Population Health at the Centers for Disease Control and Prevention. So Lisa has been doing this work for since its inception, and is a great expert and a great partner. Lisa, we're really happy to have you here today. Next, we'll hear from John Sheen. John is Associate Director for the Healthy Brain Initiative at the Alzheimer's Association. John, thanks so much for joining us today. We look forward to hearing about the work that you all have done. And then last, but certainly not least, we have Linda Taylor, who is the coordinator for the Alzheimer's disease program at the Texas Department. I don't know if I'm going to get this right. The Texas State Department. I'm not going to get it right, Linda, you'll have to do it, Department of Health Services. Anyway, and she is going to share the actual implementation. Oh, it's right here, Texas Department of State Health Services, sorry. Linda is going to share with us the actual implementation example for the Healthy Brain Initiative. So I think that will be really helpful and valuable presentation. Linda, thanks so much for being here. So I'm going to go ahead and we'll advance to the next slide. And Lisa, we're going to turn it over to you.
Great. Thank you so much, Megan. And the next slide, please. So I'm going to frame my presentation today on the past, the present, and the future. So next slide, please. So we'll start with the past, or what we know now. So the scope of Alzheimer's disease, the epidemic in the US, we know that based on the most recent Alzheimer's Association statistics, we know that more than 6.2 million adults have Alzheimer's disease or related dementia. We see that there is a distinct link between Alzheimer's and chronological age. We also know that 2/3 of the majority of those people with Alzheimer's are women. And we know that the majority live in a community setting. So they live in their home in the community, or they live with family members in the community, and that about 1/4 of them are actually living alone. We know statistically that 1 out of 3 older adults do die with Alzheimer's disease or related dementia. Next slide, please. So what I wanted to show you were some updated death statistics. And these are very updated because, as you can see here, we can see COVID-19 listed as a 3rd leading cause of death. So, but we want to point out here that Alzheimer's disease is a top 10 leading cause of death. So for all ages, we see that Alzheimer's disease is the 7th leading cause of death. It was the 6th leading cause of death prior to the COVID-19 pandemic. Next slide, please. We expect that the number of people with Alzheimer's disease will increase over time, as you saw on my first slide, which showed some of the link between chronological age. We also know that we see racial and ethnic differences related to Alzheimer's disease and related dementias, as this slide illustrates too. Next slide, please. Few more facts that we know that, and these are linked to some national objectives as well too. So we know first that about 60% of people who are diagnosed with a dementia or their caregiver are actually made aware or are aware of that diagnosis. We know that about 1/4 of the hospitalizations of people who are diagnosed with dementia are actually preventable. So these could be things such as influenza. These could be things such as falls. It may be things such as their blood glucose not being managed in a way, and they end up having some challenges with their blood sugar or their hypertension. The third statistic on here that is really important for us to think about too is we know that 45%, a little less than half of people who have said their memory has gotten worse over the past year have actually spoken with their healthcare provider about it. We also know that people who report that their memory is getting worse over time or have that subjective cognitive decline tend to report other health conditions too. And we know that of caregivers, 1 out of 3 says that their health is getting worse. So these may seem to be kind of a jumbled set of facts and statistics, but as you see through my presentation today, these will make sense why I presented these to us at the very, very beginning. So a little bit more about the past. Next slide, please. So this slide illustrates the past related to the Healthy Brain Initiative at CDC and the Roadmap series. You can see that it started in 2005 with support from Congress. The first roadmap was developed. Then we started developing modules for the behavioral risk factor surveillance system. Then dementia was included in 2010 for the very, very first time in the Healthy People Objectives. 2011, President Obama signed into law the National Alzheimer's Project Act, which set national goals and objectives to help us, find a cure or reduce the prevalence of Alzheimer's disease by 2025. You can see that that group develops a national plan. We've developed more roadmaps. In 2018, President Trump signed into law the BOLD, Building Our Largest Dementia Infrastructure for Alzheimer's Disease. And then we're very proud to say that in 2020, we were able to make our first awards for those BOLD recipients, which I will talk a little bit about those in just a second. Next slide, please. Okay, one more, please. So we're going to get into the present. So up in the left-hand corner here, you see our Healthy Brain Initiative roadmap for state and local public health partnership. One of the really unique things that we did in developing that roadmap, and John was very integrally involved in developing that roadmap, is we took a life course perspective. So what you're looking at here is you're looking at the trajectory of a person at birth who will eventually develop Alzheimer's disease and die from that disease. But what we can see here is we see the trajectory of that disease progression that they go through, the healthy cognitive functioning, the pre-symptomatic, the mild cognitive impairment, and the dementia phases. So that was a unique addition to this version of the roadmap. But what we've done with the outer circles or the outer layers of this graphic is we've shown those opportunities and those places that public health can intervene. So the first section is the risk reduction. So in other words, it may be primary risk reduction, secondary or tertiary, but we see where public health does have some of those opportunities to intervene, as well as with the early detection and diagnosis, the safety and quality of care. So in other words, making sure that our caregivers have their needs met for their health and well-being, but also have the skills they need to provide the care for the person that they are caring for, as well as making sure that the person that's receiving care is not only aware of their diagnosis, but at the same time is having their other health needs met, as well as risks for potential injury reduced as well too. So that was one of the things that we did. So in the next slide, I talk a little bit about that Healthy Brain Initiative. So really the whole goal of that Healthy Brain Initiative is to integrate brain health at a national level into public health practice. Next slide. And the way that we do that is through our roadmap series, which you can see listed here. So those are our 3 roadmaps that we've done historically for the state and local public health. And we do align our roadmaps with 4 4 of the 10 essential services for public health. So you can see the upper right-hand graphic, those are the essential services that our roadmap aligns with. And yes, the essential services have been updated since we released our roadmap, but our new roadmap that will be released in late 2023 or in early 2024 will be with the newest essential services of public health. Next slide. So in that roadmap, we have 25 actions that are consistent with those essential services. And you can see the categories that we've identified those roadmap actions in. So in other words, making sure our workforces are competent and prepared, making sure that we monitor and evaluate. We have to know when change happens, or if we're developing an intervention or giving intervention, when is it working, when is it not working? We know with public health, we get things done through policy levers, as well as making partners and working together collaboratively, as you all are doing today. And then providing education that can allow communities to be empowered. Next slide. So when we were developing that third roadmap, we were looking at the success of our second roadmap. And so one of the communities that we didn't see as much impact in was American Indian and Alaskan Natives. So we started digging and thinking, why? Why is our roadmap not being utilized in those populations? You know, what's different and what are some of the challenges and the issues? And we all went, oh, it's very different. You can't have a one size fits all when the systems are structured differently, healthcare operates differently, we have different cultural views, approaches, etc. So we started out to make a short addendum to our roadmap. Needless to say, about 6 months later, actually it was closer to 18 months total, and about 50 pages later, we have a roadmap developed exclusively for Indian country, that we worked with a lot of tribal leaders. We focused group with tribal members, images, made sure we were hitting the information that was most relevant and most needed and would really resonate in Indian country, both on reservations as well as those tribal members that are residing in urban communities. Next slide, please. So you can see that the strategies, and these are the big broad categories of the strategies that we have for our roadmap for Indian country, they're similar, but yet somewhat different. So in other words, the first one is educate and empower community members. So once again, great opportunities for public health. Same thing with data. So before we said monitor and evaluate. So we talked about collecting data and not just collecting it. That data that public health collects is valuable and can really inform the kinds of things that we do. So we want to make sure that communities, all communities, tribal as well as non-tribal, use that data that they collect for action, and always looking at strengthening the workforce. And by workforce, we just don't need MDs. We mean the whole workforce that interacts broadly. Next slide, please. So just a little bit about our Healthy Brain Initiative. So I mentioned in my nice graphic, our timeline that in 2020, we funded our next round of recipients for the National Healthy Brain Initiative. We took a little bit different approach, or a fresh approach to doing that. These are 5-year awards. So when you get an opportunity to freshen up every 5 years, you definitely take it. So we have a component A recipient, and the component A is really an organization, or designed to be an organization with a national scope that has reach within the states, who can really help at that national level, develop the strategies included in the roadmap, assist with healthy people goals and objectives as well. And the competitive application that was awarded was to the Alzheimer's Association. So component B was a very new approach for us. We looked at the populations that have the highest burden of ADRD. And our intent was to fund organizations that work with American Indian, Alaskan Native populations, adults with intellectual and developmental disabilities, another with Hispanic Latino adults, and then a fourth one with African American adults. You can see that we did award those categories, but Us Against Alzheimer's came in with an extremely compelling application that focused on two populations and not just one. And so they are focused on both of those areas and doing an amazing, amazing job. Next slide, please. I also mentioned BOLD in my timeline. So what is BOLD? So BOLD's purpose is to create or strengthen the public health infrastructure for dementia and those caregivers that provide support for a person with dementia. Next slide, please. BOLD has three components. The first component, as you see here, is to establish public health centers of excellence. And I will show you on the next slide who they are. Then the second, not yet, sorry, I said those words I shouldn't have. The next component of BOLD is to provide funding for public health across the US. And the legislation of BOLD specifies that we would fund states, political subdivisions of states, tribes, and tribal organizations per statute. And then the third component of BOLD is to increase that data analysis and timely reporting. So as you've seen, data has been a big theme today as well too. Now the next slide. All right, so these are our BOLD public health programs that we have funded. There are two categories of funding that you see here. These are 3-year awards. The enhanced level awards, you can see those listed. Those are the 5 states here: Georgia, Minnesota, Rhode Island, Virginia, and Wisconsin. Then at the core level, we funded 11. One is a county, so Los Angeles County, and one is a tribal organization, Northwest Portland Area Indian Health Board. The difference between the core and the enhanced is the core level states needed to have an Alzheimer's plan that was done within a specified period of time. And if they didn't have that plan, they needed to come in for the core level of funding. So the big activity of the core awards is they're going to be developing state plans that are taking into account specific aspects of the roadmap actions and also developing a coalition within their award area. The enhanced awardees, on the other hand, have a state plan within that specified time window, and they were ready to hit the ground and start running and start implementing the actions that they have identified in their awards, as well as they already had a coalition formed. Next slide, please. And these are our BOLD Public Health Centers of Excellence. They are 5-year awards, and we selected 3 topics: dementia caregiving, which went to the University of Minnesota with Joe Gallagher, dementia risk reduction, Alzheimer's Association with Matthew Baumgart as the principal investigator, early detection and diagnosis of dementia went to NYU School of Medicine, and Josh Chodish is the PI there. So we're real excited. They're all working hard, various phases, both the BOLD centers and the BOLD programs, of either getting staffed up, really getting going. So when I say they were awarded in 2020, they were awarded October 1st, 2020. So they are, about 8 months-ish into their awards with a lot of holidays and COVID. So next slide, please. So data has been a theme, and we believe in data for action at CDC. And one of the ways that we try to facilitate the use of our data is through this data portal that we have. We have a data portal for older adults data, and it includes a variety of health indicators. It does include our cognitive decline module and questions from our caregiving module, but it does also include things from the core of the BRFSS too, such as health conditions. So there's a whole variety of things there. You can go into your state and you can click your state and it will generate a PDF report that you could hand to someone with whatever variables that you would like. If there's certain variables that you're interested in and you want to see how your state compares to other states, you can click and it'll give you a PDF report. If you don't like any of our PDF reports, you can download the data and make your reports as well too. So I hinted a little bit about those modules and the behavioral risk factor surveillance system. So one of the modules that we have on the behavioral risk factor surveillance system is the subjective cognitive decline module. So in other words, it asks people in the past year, has their memory gotten worse? It also asks about some of the questions associated with their daily living that they might be having due to some of those memory concerns. We ask if they've talked with a healthcare provider, and this is only asked of adults 45 years old and older. And the map, US map, shows us what years, the most recent year, your state has administered that module. And you can see there's a lot of purple, a whole lot of purple for 2019, which is exciting. And that's the most recent available data. And for the caregiving module, this is asked of all adults 18 and older. So we ask if you on the survey are providing care assistance to a family member or friend who has a chronic health condition or disability. Oh, I'm sorry, next slide, I got talking. I am so sorry. Here's the BRFS, let's pause for a second. Lots of purple on the slide. Okay, then let's catch up, next slide. Okay, so we're caught up. So the caregiving module on the BRFSS is ask of adults 18 and older, and we ask if if you're providing care for someone with a health condition or disability, a family member or friend. We're asking some characteristics of that caregiving situation. So how long have you been providing care? What's the main health concerns for the person that you're providing the care to? Their relationship to you, asking some of your care needs, some of the problems you may be facing as a caregiver. Then we ask a question of people who are not currently a caregiver. We ask if they anticipate being a caregiver in the next 2 years. You can see there's not as much purple here, but lots of state coverage. But we're working on getting more states to adopt the module here in the next few years. So the future, next slide, please. All right, well, next slide, please. We thought we had the future all mapped out, very nice with our HBI, our Healthy Brain Initiative and our BOLD recipients. And then 2020 happened with COVID. So the pictures you're seeing here, this is my mother. And you can see, you know, we all have experienced things that we never anticipated. Some of our challenges are things we never expected. We never expected to be kept away from our loved ones and missing the events that we did. We never expected that our loved ones who were in an assisted living or a long-term care facility that we put there so they could get good quality care, we wouldn't be able to interact with them. We never expected that or anticipated that, or that our only interactions for almost a year would be on an iPhone or through a window. So no matter how much we plan, things happen. And so the point that I want us to think about is we all had to pivot. We all have different issues now that we need to think about for our older adult population, and issues that we may not even be aware of yet. So yes, there was loneliness, there was social isolation, there's loss. I mean, you can see the changes in my mom's physical appearance, but let me just tell you that physical appearance echoes, or I don't know, parallels, I don't know the right term, her cognitive state. So, you know, so our loved ones that we had limited precious time with anyway, were also deteriorating as well. And yes, I use that word and it's an ugly word. And this is my mother who I love, who yesterday for the first time asked me my name, which is always, you know, everybody who has dementia experience is pausing, because you all know what it feels like or would feel like if it was you. But she did recognize I was a relative. That's a good thing. I apparently look like her people enough that I'm a relative. I'm digressing. Let me get back on script here. But I think, next slide, I think it's important for us to recognize that. So even all of our great planning that we've done, there's things that we're going to have to be thinking about. And we all are also changing the way that we're delivering telehealth, the way that we're doing therapy. Lots of things have changed. And we've got to think about, with our older adult communities, if that's really the most effective way of doing things. I also spend 25% of my time working on CDC's COVID-19 response. And very early in the response, people were saying that basically an iPad was the solution for loneliness and social isolation. Well, try to explain an iPad or pictures of people you know with dementia and put headphones on. It didn't work well in my situation. It definitely didn't work well. Okay, so our challenge, in addition to what 2020 gave us, these that we're looking at here, these 3 statistics I gave you at the very beginning, these are not only national objectives, these are Healthy People 2030 objectives, but these are also priorities for CDC's Alzheimer's disease and healthy aging program. Next slide. And so this just states the formality of the Healthy People objectives. Next slide. And so these are really the priority areas for not only our program, but I think you will see that all of these priority areas are woven into our Healthy Brain Initiative Awards, as well as our BOLD programs and our BOLD Centers of Excellence. Next slide, please. You click until it all shows up. I think one more click. Okay. So with our different funding, with our Healthy Brain Initiative A's and our B's and our BOLD centers and our BOLD programs, our vision is that they will all work together, because we know not any one group or organization can solve all of these long-term outcomes or objectives by themselves. Each one has a different piece of the puzzle, a different part of the puzzle that collectively, we are able to hopefully make a significant impact. Next slide. So just in your roles, this is one of our new products that might be useful, that in partnership with the National Association of Chronic Disease Directors, we developed a series of, these were called, rat cards in the day when we went out and we actually got cards. But these are images that, these are on our website. You can print them as rat cards if you'd like to, or you can take the content and utilize it in any way that would be useful to your constituents. The back side has a list of resources that could also be tailored too, if you would like, or used just the way they are. Okay, next slide. Okay, so in summary, I don't think I'm sharing anything new here, but we know that millions of people and their families are living with dementia and Alzheimer's disease, and we know that those numbers are going to keep growing. Public health can and does have an impact, and we know it has a role, and we need to make sure that we can maximize what public health can do, and hopefully through our Healthy Brain Initiative, our roadmap series in BOLD, we are helping public health and its partners chart that course for our dementia prepared future. Thank you. And I believe, one more, I guess I have 2 more. One more, next slide. If you do not receive our newsletter, sorry, you can go back up one more time. If you do not receive our newsletter, please go to cdc.gov/aging, and over on the left-hand side where it says get email updates, put in your email address. We send out usually weekly emails with updates of various webinars, papers that are published, new materials that we've designed. They're very short, and we would love to have you get our information. Next slide, please. And thank you very much. And the next slide, I'll turn over to my colleague, John Sheehan.
Okay, I just want to say thank you so much, Lisa. That was an excellent overview and so touching and really makes it real. Thank you for sharing your photos of your mom. She's precious. John, over to you.
Great, thank you, Megan. And thank you everyone for joining us this afternoon. As you heard, my name is John Sheehan. I'm one of our associate directors of the Healthy Brain Initiative for the Alzheimer's Association. And as I'm sure you can guess from that title alone, bulk of my work is on the Healthy Brain Initiative and really working with the HBI roadmap. Dr. McGuire just gave us a great introduction, a great scoping of the HBI, of the roadmap itself. So I'm going to take just a few minutes of your time today and talk about the utilization of that roadmap, and specifically how it can be used as a tool for public health professionals, and how we can kind of there's lots of areas of effort and how we can align those strategies to really promote healthy aging for older adults. Next slide, please. The first thing that I want to highlight is kind of this larger picture. There are a lot of existing frameworks that are out there. We heard about the HBI roadmap today. One that I'm going to talk about very quickly right now is actually from Trust for America's Health, the Age-Friendly Public Health Systems Framework. And so as you've been hearing Dr. McGuire's presentation, your wheels have been turning, thinking about how you might incorporate this focus to cognitive health, caregiving, dementia issues into your own work. I really want to encourage you to think about what the intersections are, so that we can really kind of focus and tailor our interventions on those that are going to have the biggest reach and the most impact. Next slide. I don't want to go too into the age-friendly public health system framework because I know that TIFA has much better primers on it, much better presentations on it than I could ever do it justice. But I do just want to highlight how, as we heard with the HBI roadmap, age-friendly public health systems also maps to those essential public health services. So we have that intersection, we have that overlap that allows us to really focus our energy and get really the biggest impact that we can. Slide, please. Two areas that we do that, which we'll see on the next slide, is really on the intersection between policy and in practice. And hopefully I didn't freeze, there we go. One of the things that both frameworks do is one of the areas of intersection that we have is really a focused attention on increasing health education and communication about older adults to not only the general public, but to the healthcare provider community as well. Similarly, both call for, as we heard earlier, the need for a well-trained, competent workforce, for continuing education and training for that workforce, in that workforce development component. And as we all know, the last year has really elevated attention to emergency preparedness and response. Older adults, as we know, have their own unique considerations. When we think about emergency response, COVID-19, of course, brings that into sharp focus. But in addition, older adults with dementia have additional layers, additional considerations that need to be taken into account when developing those preparedness and response plans. Next slide, please. On the kind of the practice side, they're both public health frameworks. And as those public health frameworks, the data are essential to moving both forward. They inform our decisions, they help us evaluate outcomes. And we both have a really big focus on using, collecting, and evaluating data. Similarly, inclusion of diverse perspective, inclusion of diverse input throughout all stages of intervention is essential to both. Making sure that the programs, the policies, the systems change that we're working to implement are reflective of the communities that we're working in is essential to the success for both. Any public health plan, any public health framework worth its salt, of course, needs to have cross-sector partnerships, and both really focus on those larger, far-reaching, kind of high-impact interventions at the policy, system, and environmental change levels. Next slide. One of the things that we have in both the HBI roadmap as well as age-friendly public health systems is the health equity component, reducing health disparities. For the sake of time today, I'm not going to go too into these statistics here, but we know as public health professionals, as we collect data, as we use data, we need to examine the differential impact that health conditions, that demographics have on our communities to really illuminate where our efforts can do the most good, where we can reduce the biggest burden overall. Health disparities, of course, as we all know, exist by gender, race and ethnicity, demographics, educational attainment. You see some of those examples on your screen. But we have that not only for our general population, but for our older adult population too. We see it in those chronic conditions, but here on this slide, we know that, we can go forward, that'd be great. We know that just as it impacts chronic conditions, those disparities impact chronic conditions. We see it here as well with dementia. To give you a few of those statistics that we heard a little bit before, Black adults, Hispanic adults living in America currently are at a higher risk of having Alzheimer's or a different dementia, and yet they're less likely to actually have a formal diagnosis documented in their medical records. Women disproportionately share the bulk of the burden of Alzheimer's disease, both as individuals living with dementia, but also on the caregiver front. 2/3 of all caregivers for someone living with dementia are women. And so we see these disparities. There's many more than I included here today, but we see those disparities across the entire older adult population. But even when we narrow in and focus on those living with cognitive impairment or cognitive decline, we still see really stark differential impact. So as you're listening today and as you listen to our next speaker, think about when, I want you to keep in mind prioritizing those policies or the systems change that really help address the disparities, especially those that do root cause analysis. Again, just so we can expand our reach and have the biggest, greatest impact overall. Next slide. I'll go quickly through these because I do want to tease and get to our next speaker, which is much more interesting, at least from my perspective, than the numbers. But to give you a little sense of the current utilization of the HBI roadmap specifically, we're over halfway through the roadmap itself, 2018 to 2023. And in that time, we've seen excellent implementation and growth from state and local public health agencies. These numbers here are all related to the state and local roadmap, not to the roadmap for Indian country, just to point that out here. And this is just a particular snapshot in time. I don't want to dwell on the numbers themselves too much. We didn't do any like t-testing for validity and all of that kind of stuff. But I do want to point out that that really the takeaway from this slide is kind of comparing about a 14-month period, the first half to the second half. We saw a growth in the number of projects that state public health agencies were implementing related to the Healthy Brain Initiative roadmap. That growth that we see is encouraging because we know that state public health agencies are recognizing their role to address dementia, to address cognitive health, to address caregiving, and are taking the appropriate actions to incorporate it into their work. Next slide. This offers just a different slice of those numbers, looking at where what focus, what domain that area of action was concentrated in. And here, again, the takeaway is comparing period 1 to period 2 and seeing that growth between the two periods. If you're good at mental math, much better than I am, and you did kind of quickly sum each of those columns, you know that they didn't total what we had on the previous slide. And that's because a lot of interventions that we see, a lot of implementation of the HBI roadmap really encompass multiple roadmap actions. And that's largely indicative of kind of those, that far-reaching, kind of the large, high-impact interventions that we are seeing that kind of hit multiple areas of the essential public health services, but also those essential domains of the HBI roadmap. On the next slide, I want to point just to some quick resources at alz.org/publichealth. I encourage you to take a look when you do have a chance to do so. And these are, some are I guess, repeated references from what CDC just covered, but we do have some different materials on our website. Both are great, excellent resources to find tools, data, resources in order to accomplish this work. And the big thing here that I'll point out is that fourth bullet down, examples of roadmap implementation by public health. We're actually going to hear about one of those examples in just a few minutes. But here you'll be able to find case studies. You'll be able to find implementation examples of, how do I take this framework, this HBI roadmap, how has a public health agency been able to translate it into action? Next slide. Our takeaways, please use those unique capabilities that public health has, especially those far-reaching whole person, whole community approaches to incorporate cognitive decline, Alzheimer's, and caregiving issues into the existing work. Of course, health equity is a huge component of that, targeting, specifically focusing our attention on the populations that have the biggest disparities in order to reduce that greatest burden. And the HBI roadmap and age-friendly public health service or public health systems framework are two great tools that you can use to accomplish that. The next slide is just a tease for our next presenter here. What I want you to keep in mind, I don't want to steal any of Linda's thunder for her presentation, but what I want you to keep in mind here is thinking of those large kind of overarching implementation examples. How multiple HBI roadmap actions, the ones I listed down here, are the ones I think apply to this particular program, and how kind of a holistic approach that reaches into a wide swath of the community really does have multiple actions and a wide-reaching impact. I have one final slide, just encouraging you to check out alz.org/publichealth for other examples. They'll be in the slide deck that we send out after the fact. But I will stop yammering at this point so we can have some good implementation discussion and turn it over to Linda. Great.
Great. Thank you, John. I really appreciate that. And hello, everyone. I'm really honored to be here today to share some of the work that we're doing in Texas, specifically about our public awareness campaign. And first of all, I just want to let you know I'm the coordinator for the Alzheimer's disease program with the Texas Department of State Health Services, or we refer to it as DSHS. And I'm happy to let you know about some things that are going on. And John, I really appreciate the connection and the shoe in there. So to the roadmap. You know, our campaign is one of the suggested activities in our Texas state plan for Alzheimer's disease. And this plan is a resource with recommendations and strategies for any Texas stakeholder to follow. And we did rely on the Healthy Brain Initiative roadmap to develop the state plan. It was very instrumental in helping us understand how to organize our ideas and to make them actionable for our stakeholders. So we were grateful to have that as a resource. And in our state plan, we included a priority area for education and awareness, which stems from that educate and empower area from the roadmap. And from that, we developed, we suggest awareness campaigns under that priority area. And so we followed that suggestion ourselves. Before I get into the rest of the slides, I do want to point out that the state plan and all of the campaign materials that I'll be referring to today are available on our program website. And that is dshs.texas.gov/Alzheimer's. So I just want to make you aware of that. So next slide, please. So the 86th Texas legislature allocated $1 million to DSHS to produce an Alzheimer's disease public awareness campaign. And this was for fiscal years 2020 through 21, and the campaign launched in August of 2020. And this is the first direct investment in Alzheimer's disease outreach. And the funds supported market research, TV and radio, public service announcements, print and digital media, reference resources and fact sheets. And I'm sorry, I'm hesitating because one of the pop-up blocks completely obscured my screen. Reference resources and fact sheets, web page updates, and data collection. Next slide, please. So with our campaign goals, we want to help people recognize the early signs and symptoms of Alzheimer's disease and encourage them to start a conversation as soon as possible with their loved ones when they start to see those signs. And we want to convey that ongoing problems with memory and thinking and behavior, they're not a normal part of aging. We also want to help drive traffic to our program website where we have information and lists of resources in the community, because that's such a big issue with caregivers knowing where to begin and the places to reach out to. We also want to empower our stakeholders to disseminate campaign resources through their own networks. Next slide, please. So our primary audience is family members, spouses, partners, friends, and healthcare providers of people showing signs of Alzheimer's disease. Age range is 40 to 59, majority female, all racial and ethnic groups. And our secondary audience is older adults who may be unable or unwilling to recognize symptoms of cognitive decline in themselves, or think that dementia and memory loss are just normal parts of aging. And that would be ages 60 plus, majority female, all racial and ethnic groups. Next slide. So our strategic approach in developing this campaign started with reviewing best practices from other state and national initiatives. We did reach out to the Alzheimer's Association to talk with them about their starting a conversation campaign, and that was very helpful to us. We conducted market research among target audiences and developed key messages to create the campaign brand, and designed and produced a suite of evergreen materials that we hope will last a long time, and plan and implement a cost-efficient paid media plan, generate engagement with social media, and we want to always extend and sustain our messaging distribution through our partnerships. That's a big part of this campaign. Next slide, please. So our marketing vendor conducted focus groups in English and Spanish, with most participants having very little knowledge of the signs of Alzheimer's disease other than just memory loss, the kind of stuff anybody might know about. And we learned that participants trusted the messages, or said that they would trust the messages from the AFPHS for the reason of thinking that we weren't trying to sell them something. So that was an interesting thing for us to learn. And the overarching message that most resonated with our participants became the campaign tagline, which is see the signs and start a conversation. Next slide. So the next couple of slides are going to be examples of some of the marketing materials. John showed you, I think, one of these in his slide, but these are available in both English and Spanish. And all of these materials that I'll be showing you are available on our website. So this is an example of a print ad, one in English, one in Spanish. Next slide. This is examples of digital display ads. Next slide. And then here we have examples of social media posts. Next slide. And some of the other campaign materials that we developed include a newsletter that our stakeholders can use and distribute through their networks, TV and radio spots, posters, push cards, and fact sheet on understanding how to start a conversation when you start to see the signs, one directed to caregivers and one to help healthcare providers talk with their patients about that specific issue. Next slide. So what you see here is the landing page for our Alzheimer's disease campaign and what we're calling the toolkit, which is all of the product that's developed for this campaign. So if you go to our homepage of our program website and look to the left, navigation there where that yellow arrow is, and just click on the Alzheimer's campaign toolkit link there, it'll show you all of the materials, and the print materials, and if you scroll further down, it'll show all the radio and TV spots as well. Next slide. So our results for fiscal year 2020 include more than 21 million impressions total, over 17,000 television radio spots aired statewide, print generated over 500,000 total impressions, digital and social media produced over 20 million impressions, and there were more than 800 page visits in the first 2 months of the campaign. Next slide, please. So our next steps. We definitely want to increase diversity within the campaign and the audiences that we can reach in crafting our messages. And we want to continue to add important, relevant information to our website, as well as relevant resources, not only for the general public, but resources to help professionals who are caring for those individuals. And we also want to be looking at ways to cross-message with other chronic diseases. And for example, the message about heart health is tied to brain health. Next slide, please. So to have more communities see themselves represented in our resources and materials, our marketing vendor is currently drafting a set of digital creatives for Asian American communities. And that's an example that you see right here. So we're just beginning to move beyond our Spanish-speaking populations. Next step, next steps, but next slide. So we're able to do some cross-messaging with the DSHS Heart Disease and Stroke Program. And this right here is an example of a social media message we used to promote National Stroke Awareness Month, which was in May. And next slide. And some of you may recognize this. We have added a 2-page flyer to the Alzheimer's Disease Program website that highlights the connection between heart health and brain health. And this is the template created by the Association of State and Territorial Health Officials with the Alzheimer's Association. So we are grateful to be able to use this. And we do have this available with Texas statistics in it on our webpage. Next slide, please. So really that's a quick overview of our campaign. We've done a lot of hard work over the past 2 years and we're very proud of the campaign. And we're also happy that funding to support the campaign moving forward in the fiscal year 2022-23 has gone through. So we will continue. So I want to thank you all very much. I'll point out my email address is there on the screen. And I just appreciate being able to share some of our work with you.
Great, thank you so much, Linda, John, and Lisa. Very helpful information. Karan, do you want to take down the slides for us, and so we can see each other? So I just want to open this up. We have about 7 minutes for questions for our guests, and if our speakers have questions for each other or comments for each other as well, feel free to just go ahead and unmute yourselves and ask your question or put them in the chat and we will ask them for you.
I just want to say great work, Linda. And it's always so exciting to see materials that we or the association or all of us have worked on collaboratively, seeing those being utilized. Plus, I loved your Scrabble stuff.
Thank you for that. You know, we had a really talented marketing vendor that helped us do some original things.
Hi, this is Marcy Getz from Washington State. And Linda, it's so great to see you on screen. Linda had asked us for some information in Washington State, and we've developed a toolkit, and Linda was great enough to be one of our pilot folks with it. So it's almost done. It's just been a little behind in its graphic design work due to COVID. But anyway, it's great to see you, and what a wonderful campaign you've done. And I guess I just want to thank all the presenters and to say that I think that it was really strategic and impressive that the CDC and the Alzheimer's Association worked together to create the Healthy Brain Initiative. And it sets a really great roadmap for folks in public health to start the discussion and to lead and make the connections for people about brain health and all the chronic diseases that we address. So I really want to thank you and to say that we've been really excited in Washington to utilize it and has found it to be really successful, especially with using the life course theory. So anyway, thank you, everyone.
And I just want to say it's great to see you too, Marcy.
Thanks.
We'll need to be in touch.
Thanks, Marcy. You know, it's always interesting when I hear the fact that healthy aging does not involve Alzheimer's and dementia, that it's actually not part of healthy aging. I just wonder, if others, if that's a surprise. But I think it goes to the importance of public health and all the different ways that public health can offer preventive programs for brain health. So I think that Linda, that's exactly what your campaign is doing, and just really appreciate all that work. Other questions or comments?
Hey, John, this is Marcy again. I think it was on your slide. I don't know if it was slide 40 or 41. And I don't know if I misread it, but there was something on there about low vision. Can you speak more to that? I'm not as familiar with that statistic.
Yeah, definitely. So the low vision, the reason I included this on there, and I know I did just breeze right by it for time's sake, was as an example of one of those intersections. So low vision is, we're still kind of, the research field, I shouldn't include me in that, but we're still kind of examining if there is a connection between vision loss, low vision, and future dementia decline or future cognitive decline. But as you're thinking about the intersections, we know that there are disparities that exist among certain populations, the Black community, Medicaid enrollees, that have higher proportion of, kind of shoulder a higher proportion of low vision difficulties. And as public health practitioners think through interventions to address that disparity, those that individuals that fit into that population, but also have a higher risk of cognitive decline or a higher risk of dementia. That's really where I wanted that kind of that data statistic to come in and think about what are the unique considerations for addressing that burden. How could we address not only the low vision component, the low vision disparity that we see, but then those that might have cognitive issues or even be living with dementia at the time, and what unique considerations need to go in for that intervention.
Thanks, John. Any other questions? Great. Well, we are at just about out of time, so I will close us out here. Again, thank you all so much for the great information. We have recorded this session, and we will be posting it on our website at afphs.org under events. You can also sign up there for our next training sessions. The next one will be 1 month from today, July 15th, where we will be talking about caregiving as a public health issue. We'll have representatives from the National Alliance for Caregiving and at least one other still TBD. But we want to continue to make these trainings relevant for you all. If you have ideas about what would be helpful for you, please let us know. Thanks, Karan, for popping that into the chat, the registration for the next one. And also, please sign up for our newsletter on the website that will alert you to a number of other trainings and by other organizations and lots of news and resources to enhance your work in healthy aging. So great presenters today. Thank you all so much for your partnership and all the work that you're doing. Thank you all in the audience for all that you're doing for older adult health. And I hope you all have a great rest of your afternoon and a great weekend.
Thanks again. It was wonderful.
Thanks, everyone.